Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. This is our first video about infections arises from mandibular teeth. In this video, we will present an overview about vestibular, buccal, and space of the body of mandible infection. This is a flow chart shows the spread of infection. The infections may enter the vestibular, buccal space of the body of mandible, then the sublingual or submandibular, the masticator space, and from here to the deep neck spaces, and finally may enter the mediastinum. The initial spread of infections occur through vestibular buccal space of the body of the mandible. However, infections may also initially or secondarily enter the sublingual space or submandibular space and the masticator space. The most initial common route of spread for infections originating from the mandibular teeth is the vestibular space. However, as stated earlier, initially it can enter the space of the body of mandible, the submandibular, sublingual, submental, or masticator. From here, infections may travel to the secondary or deep neck facial spaces and even extend into the mediastinum and to threaten the heart, lungs, and great vessels. If an infection arising from a mandibular posterior tooth perforates the buccal cortical bone and the periosteum inferior to the attachment of the buccinator muscle, then the buccal space is involved. Another view showing that when the cortical perforation is inferior to the buccinator attachment in the mandible, the buccal space will be involved. For more detail about buccal space infections, watch our video about infections arising from the maxillary teeth in the part 1 of that lecture. The space of the body of mandible is a potential space between the cortical bone of the mandible and the overlying periosteum and becomes involved when an infection erodes the buccal cortical bone but does not perforate the periosteum. It can essentially peel the periosteal layer of the soft tissues off the bony surface, leading to the creation of an infection between the bone and the periosteum of the mandible. Similar to the palatal space in the maxilla, a space that is also formed between the bone and the overlying periosteum, infections of this space can become very diffuse due to the shape of the mandible, and it can appear as if the bone itself has been enlarged. It may extend to the adjacent spaces, that is buccal, sublingual, submandibular spaces. Here in this clinical picture, an infection arising from the mandibular tooth apex that is located caudal to the attachment of the buccinator muscle will initially involve the space of the body of mandible and then secondarily affect the buccal space. On clinical examination, it is a foam swelling and it appears as if the mandible itself is enlarged by the subperiosteal collection of the fluid. But remember, diagnosis is easy because there will be a history of short onset of swelling, and odontogenic cause will be obvious due to dental pain and clinical examination. Thank you. Wish you best of luck.